And good morning and Happy New Year to everyone. My name is Anna Swardensky, and I am CADRE's Director of Planning, Training, and Community Resilience. Welcome to this morning's webinar on recovery planning, a whole community discussion for Santa Clara County. By way of welcome and introductions, hang on just a moment, I'm multitasking here, trying to get everybody in and slides moving. For those of you who are just joining us, if you wouldn't mind putting in the chat box your first name, your name of your agency, and one word on how you're feeling today as we get underway with this new year. Part of our goal usually with our CADRE training sessions is to help foster relationships and community building. And I know that's a little bit more difficult in our virtual environments during this COVID pandemic, but to the degree that you are willing to, if you would leave your cameras on so we can put names and faces together. And if you'll use the chat box to share information along the way, or raise your hand if you have a verbal comment that you'd like to chime in on. And so let's see, in terms of housekeeping notes really quickly, we are running 2 accessibility features today. Zoom live transcript is operating. It allows you to see subtitles along the bottom of your screen, which you can toggle on or off. You can also open a full transcript window. It operates like the chat box, and you can leave that running in the side if that is helpful and useful to you. The other is Otter AI as a transcription service, and that will open a separate browser window for you. One of the AFN considerations I will ask for your cooperation with is we have been asked if we can limit chat if needed to and utilize the raise hand feature. Sometimes folks using screen readers have a difficulty with the slides running and chat box with screen readers. So if you are using a screen reader, please feel free to direct message me if you are having any accessibility needs, and I will work on that directly with you. So that is why I should be at the top of your screen, access-Anna, that's me. I'm your host for today's session, and let's go ahead and get underway. So today's agenda, I'll go over our session objectives in just a moment. We are pleased to have a number of speakers here today to share with you recovery planning frameworks from both the county and the city of San Jose. And if there are others of you joining from other jurisdictions that have something to share, we have room in the program after our 2 government speakers to also add additional information. Just direct message me and we'll fit you in. Following that segment, we have a session or a component for nonprofit perspectives on recovery planning, and we have 2 speakers to share that. And then we hope to have enough time at the end for any additional participant sharing you all might like to chime in with, and Q&A. So with that, let's keep going. Our session objectives are to learn about the recovery planning structures that are currently in place for Santa Clara County, the city of San Jose, and any others that those of you on today's call may know of. To hear from our nonprofit leaders who are currently involved in recovery efforts, and identify ways others of you who are interested can join and become more engaged in this work. And lastly, to foster greater understandings and a whole community planning for those who live and work in Santa Clara County. I neglected one housekeeping note. Today's workshop is funded by our County Office of Emergency Management through something called the EMPG Grant Program, the Emergency Management Performance Grant Program. And so with that, we offer our thanks to our county for funding these efforts to share and offer training opportunities to our nonprofit and community-based sectors. Our first speaker for today is Daryl Ray. He is the Deputy Director for the Office of Emergency Management for Santa Clara County. Daryl's been with OEM since 2015 and was promoted to the Deputy Director in August of 2020. He's a veteran of the U.S. Air Force who rose to the rank of Staff Sergeant over an 8-year career. And during his time with the Air Force, he served as an emergency manager and was stationed in Georgia and in Florida. Daryl has been active with CADRE's leadership for a number of years and believes all county community members have an essential role in emergency management and actively works to understand the unique needs of our whole community. And with that, I welcome Daryl to kick off our program.
Great, thank you very much, Anna. I really appreciate that. I particularly appreciate everybody joining us for this webinar. It's County OEM's philosophy, my personal philosophy, that government does a response. It's the primary player during a response operation, but the community does recovery. And government can help facilitate that, but if the community doesn't do the work on the ground, that it doesn't really get done. So that the county can, or the government can provide funds and initiatives, that sort of thing. But if folks don't show up, it's kind of like that baseball movie, Field of Dreams, that if people don't show up, then it's no good. It doesn't actually occur. So thank you all very much for showing up here. It demonstrates your dedication and commitment to the recovery process from COVID-19 in Santa Clara County. I'm particularly interested, I'm going to share some of the stuff that the county has been doing over the last several months. But I'm particularly interested in hearing what the community is doing with their own organic grassroots initiatives are, because again, our philosophy is that the community does recovery. So I'm interested in hearing from you all later in the presentation, later in the webinar, to get a holistic picture, a more comprehensive picture of all of the recovery initiatives and actions that are taking place throughout the county, or the operational area, as we call it. So first, am I able to do the slides, Anna, or you do them? You do them? Okay, cool. Go ahead and advance if you don't mind. So I've kind of like broken this down a bit differently. It's not strictly what we would academically refer to as recovery. I've kind of looked at it more like relief in recovery. This is a persistent hazard. It's not an earthquake that happened and then there were damages and then we have to recover from those damages or the consequences of that earthquake or that naturally occurring event. FEMA uses the term new normal, and this truly is the starkest event that I've ever seen, where there really is a new normal in order to combat the hazard that we're facing. So I have included some relief type funding as well. And what this relief type funding is doing is helping governments, local governments and county governments to expand their operations to respond better in the future to COVID. Instead of leaving them at the baseline that they were at when we first hit COVID, we've gotten a bunch of funding to increase our capability to combat COVID going into the future. Without this, we may never go into a true recovery, academically termed recovery phase. So I just wanted to share some of this stuff. So ELC is basically an initiative to increase a capability, and that capability is epidemiology and laboratory capacity for prevention and control of emerging infectious diseases. So that's the capability that they're trying to enhance in order to meet the demand of COVID, the COVID-19 response. So that's how we were able to do contact tracing, surveillance, laboratory testing, advanced data exchange. So for example, what we mean by that data exchange type stuff or improved surveillance and reporting. So the state had a reporting tool that we used to use, and it would break quite frequently. It was an antiquated system for reporting infectious disease, your numbers essentially for infectious disease. And that essentially would, let's say there was no COVID, and you would use this system to put in infectious diseases, known infectious diseases, and that's the state surveillance system to say, yes, there's an outbreak going on, and they would be able to red flag emerging infectious diseases But that system, like I said, was antiquated, and it was we were relying on a state system. So we were given federal funding, to develop our own internal in-house system that we can still share the numbers. It still pushes data into that state system, but it's locally controlled. And so if there's ever a problem with it, we can fix it locally. We don't have to wait on the state to fix it. So that's what that improved surveillance and reporting electronic data, health data, is related to. And then the supplies, salaries, all the extra stuff that we had to procure and acquire, whether it's personnel or supplies or different types of equipment, to meet the challenge of COVID. So we had hundreds of contact tracers that we never had before. They weren't part of the county budget at all before. And so we used some federal grants in order to onboard a bunch of contact tracers and additional epidemiologists, specialists, essentially, to combat the pandemic. Also, a bunch of money went to hospitals. Hospitals took a big hit. Hospitals are businesses. So when they're not able to do elective surgeries and they have to send staff home, or they have to pick up new staff in order to increase their own labor force to meet the demand of COVID on their bed count, essentially, they also received a bunch of funding. So this $117 million went to, it was divided up among all of the different various hospitals in the county to pay for those costs, to make sure they didn't go out of business while the pandemic was going on. That would have been a tragic, not for just the hospital, but for our own health system during the pandemic and then after the pandemic. So that was intended to keep them in business. And then we had a large funding, federal funding from the CARES Act, and it essentially all that public service that we were able to provide. I'll give you an example. So our director, without giving away too much medical stuff, our director knew, tested positive, and somebody from the county called and said, "Do you need rental assistance? Do you need any food for the week?" That sort of thing, and then brought over a bunch of food for that person. So all of that type of stuff came from the CARES Act for the county and local governments to provide social services so that folks didn't suffer as a result of loss of work from being sick or being forced to quarantine or shelter in place. So I just wanted to share this with you, that a lot of the initial funding that we received was used to bolster our capacity to deal with the pandemic itself.
Oops, Daryl, there you go. You hit
Cool.
Your mute button.
Cool. I was afraid I was on it the entire time, and I was like, why didn't anybody say I was on mute for the last 5 minutes? That would have been awful. All right, so more traditional recovery type stuff. Emergency rental assistance was huge. So there were 2 rounds of emergency rental assistance that we received. So that includes federal funding, about $27 million, and then $30 million. But we also worked with the city of San Jose and received additional funding of about $17.5 million to provide rental assistance. So instead of a bunch of jurisdictions trying to do it individually, the county rolled it up into a centralized location to provide rental assistance. Project Homekey is one of my favorite recovery funds. So one of the things that you'll notice about the COVID recovery funds versus traditional recovery resources, whether it's funding or other initiatives, is that this funding is very broad-based as it relates to social safety net type items. I think there was I know that there was a huge recognition that the most vulnerable among us, they needed additional support in order to control the pandemic. So we have things like supportive housing type stuff. Project Home Key is one of those things. So it's a permanent supportive housing. It isn't just like, let's get people into hotels. This is helping to people to find permanent housing. So I really liked the Project Home Key initiative. The Social Services Agency received about $14 million in various grants to assist families directly, families and individuals. And you'll hear from Quincy Q later on from the Bridge to Recovery operation, which is an NGO operation for doing this, coordinating NGOs to assist families and individuals. And so that's where that funding came from, was that $14 million. They are using that money for other direct initiatives, but not just the Bridge to Recovery folks. And then additional community support. So the Silicon Valley Community Foundation got some funds to do local recovery. And then there are additional $12 million in loans and grants to local small businesses. So that's through our finance agency. And then also local governments. You can go to their web pages, and there's usually a spot. I've gone to all of them, and I can't tell you if, I think every single city has, like, if you need small business help, click here. And that's an extension of the county's initiative through our finance agency, providing those grants and loans to small businesses. And what I like about this slide is demonstrating that government really is just the facilitator, is primarily a facilitator of recovery, and not necessarily the prime mover of recovery. This is how we're facilitating it. So those social services dollars going to NGOs, the non-governmental organizations, the other community support, so the stuff going to Silicon Valley Community Foundation, that is the community, and the funding is the facilitation for that recovery. The only thing that's direct here is the emergency rental assistance. That is a direct program from the county, but everything else is a partnership with an NGO, a community or a community-based organization. That these initiatives wouldn't happen if it weren't for those organizations stepping up in providing the vitality, the action that is needed for a successful relief and recovery operation. Cool, great. If you don't mind. So moving into the American Rescue Plan Act. So this gets a little bit more, it's not exactly as straightforward as the HEROES or the CARES Act stuff that we just covered, which is where that relief funding came from, those two acts. So this act really is meant to be the recovery funding. What is different about this recovery funding versus funding that I have had experience with in the past is most of that funding in the past comes from the Stafford Act, not the funding itself, but the mechanism for delivering the fund, requesting the funding, and then having the funding delivered to you. So there's a bunch of eligibility requirements and parameters for being able to use the money, like you can only use the money for this and not for that. That is not the case with this funding. This funding is much more open-ended, and local governments are able to choose what the initiatives they want to push that funding towards. And I think that's, again, a recognition that that this is just a different pandemic. Number one, it's persistent, and number two, it doesn't hit all of us equally. Like an earthquake might not, it definitely doesn't hit, an earthquake won't hit us all equally, but it is a pretty good equalizer, close to an equalizer type of event. That an earthquake doesn't care if you're rich or poor, but COVID does seem to care if you're vulnerable or not. That's kind of how you get it, by being in a vulnerable group. So a lot of this funding is also likely to be allocated to in social services type initiatives. So you can see here that back in May in 2021, we received about $187 million. And then this coming up May, we'll receive another installment of $187 million. So just shy of $400 million or so between the two rounds of funding. Back in August, county administration, so the recovery team at the county, put together a recommendation for allocating that funding. The Board of Supervisors has not finalized their plan for funding allocation. But the big buckets that we recommended were $247 million towards, $44 million towards continued pandemic response, $65 million towards coordinated care to underserved groups, and then $64 million in pandemic pay. And I believe that this is the only thing, this part here, the pandemic pay, I believe that's the only part that's been approved and obligated by the Board of Supervisors. You can go ahead, Anna, and we'll go through these quickly. So I just wanted to provide, so the next few slides come from that recommendation. So these slides are screened, you know, I like snipped it, used my snipping tool in PowerPoint, and I just pushed over the slides from the Board of Supervisor presentation that was made for the recommendation of this allocation, this funding allocation. And I put it into this slide presentation. Again, this has not been finalized. This proposal has not been finalized or adopted by the board yet. All of these slides are public record. So I wanted you to have them so you could see what direction the county was leaning towards when it came to allocating these recovery funds. So our priorities for, or our strategic vision here for those funds are equity, providing a safety net, and then the continued response. You can go ahead, Anna. Great, so you can see here the different years, funding year for 21 and 22, and then 22 and 23 for behavioral health and healthcare. I'm not going to go through the details of these, so I just want you to see that how granular it does get, and then you'll have these slides as record if you want to go back and look at them in a granular fashion. But I would just want to cover the topics that we're looking at just to save some time, and I don't want to take up everybody's all the other presenters' time. So healthcare and behavioral health, which I think is huge. Children and transitional age youth, another close to $20 million, addressing needs for those most impacted. So these are like your critical, your essential workers, where everybody was saying, hey, nobody's really paying attention to essential workers or essential businesses. This is us trying to pay attention to essential workers and essential businesses. So about, what is that, about 30 million, shy of $30 million there towards that. Okay, you can go to the next one. Go back one more. So housing and homelessness, I think we all just driving around every day recognize this as a problem in our local area, in our regional area. So any kind of funding at any time is always needed. So we've allocated here about $20 million for supportive housing and other unhoused persons services. Anna? Support for justice involved clients. So one of the big vulnerable groups that we see outbreaks every week is the jail population, the folks in the jails and in the camps. So this is intended to help those folks. So that's about close to $10 million to help with our jail population. So past and future COVID-19 response. So again, I don't know if you folks ever visit the county dashboard, but we're almost to $1 billion between equipment, supplies, and salaries that we've had to dedicate solely to the pandemic. So close to $1 billion. So this is us trying to to maintain our solvency, essentially, as we continue our response. So we're looking at using close to or over $200 million to supplement the county's general fund. And again, we've already dedicated close to, I think it's over $800 million spent to date on the pandemic. Cool. All right. If there are any questions, again, I'm really looking forward to hearing what the community-based organizations have to say about their recovery initiatives, and any questions that you've got. If I don't have an answer to the question, I'll write down the answer. I'll write down your question. I'll make sure to get back to you. It wouldn't surprise me if I don't know the answer to your question. A lot of this comes from all over the place. Different organizations are doing different stuff, and I just really pulled a lot of that information together. So if you've got questions about it, I will take down that question and I will get back to you with a response as soon as I can. And I appreciate the time, Anna. This is really, really important work. So it's quite possibly the most important work that anybody will do for their community. So again, thank you very much for your participation. It's greatly appreciated.
Great. Thank you, Daryl. Thank you for your time and for all of that information. For those of you who joined us late, this session is being recorded. The slides will be posted to our CADRE website, so you can, as Daryl said, study them in a little bit more granular detail. So Daryl, there's some great comments in the box for you. The costs are eye-opening, so thank you so much for sharing that. Let's keep moving forward. Our next two speakers are from the City of San Jose. I'd like to welcome Rosalind Huey, who serves as our Deputy City Manager for the City of San Jose. She provides leadership and coordination for city offices shaping the future of the city, including planning, housing, transportation, economic development, and cultural affairs. Building on her expertise in urban planning, Rosalind's career is centered in city building, civic engagement, and leading with people. Prior to joining the City of San Jose in 2014, Rosalind was the Deputy Director for the Washington, D.C. Office of Planning. She serves on the Executive Board of the Urban Land Institute San Francisco and as a board member of We Hope and the American Leadership Forum Silicon Valley. Aurelia Bailey is also joining us from the City of San Jose this morning. She is in the City Manager's office as an assistant to the City Manager, focused on community and economic recovery task force. She comes from our San Jose Office of Emergency Management, where she spent the last 2.5 years as the program manager for the Community Emergency Response Team CERT training, which is a 20-hour disaster preparedness FEMA training. Her career at the city includes work for the Park, Recreation, and Neighborhood Services and 5 years with the Housing Department. So welcome to Rosalind and Aurelia, and I'll turn the program over to you two.
Great, thank you so much, Anna, and good morning, everyone. Aurelia and I are both delighted for the invitation and glad to be with you this morning to talk about, Daryl said it, I think some of the most important work that we'll ever do in our community. So what Aurelia and I are going to share with you about what's happening in the City of San Jose, I'm going to start off with providing a little bit of context about how we're organized and share a little bit about our recovery task force. And then Aurelia will share more details about our recovery initiatives that are underway. And so I thought it was important to start off sharing about our approach to recovery and talk about some of our fundamental principles as we do this work. And here we understand, as Daryl shared, that how we do our work together is just as important, if not more important, about what we do. And so we see recovery as work that we do with our community. None of us can do this alone. We need to do this together. And so we're really building from that foundation. And last year, back in May of last year, we presented to our city council and talked about these principles. And we shared that our work is really grounded in people, in equity, dignity, empathy, and action. And so leading from that, we are doing this work by honoring the experiences of others, And we understand the importance of valuing everyone in our community. And with that, we know that our community is beautifully diverse. And so we recognize that, and then also realize that we still have a lot in common. We go into this work admitting that we do have limitations, but we're taking full advantage of our opportunities to learn from one another. And then again, lastly, we want to make sure that we are extending empathy and really focusing on the importance of the work that responding to this pandemic has taught us, that we really do have to extend empathy. So next slide, Anna. So we also want to recognize that we are building upon a lot of previous and existing work that has already taken place throughout our community and really the region. And you'll see here on this slide, we're building from the work of the Silicon Valley Recovery Roundtable. In the city of San Jose, Councilmember Perales established a Greater Downtown Economic Recovery Task Force. So we're building upon that work. The Health and Racial Equity Task Force that has been working for several months and continues to work. And also just want to recognize the Race Equity Action Leadership Coalition, or REAL. This group is made up of a host of various nonprofit organizations throughout our region. And they have principles that we've embraced as well. And so wanted to just acknowledge their work. Next slide. So I want to share a little bit of how we got to the COVID-19 Recovery Task Force in the city of San Jose. And it was actually back in March of last year that the City Council developed a common understanding of our city roadmap. And really, this is a new framework for a prioritization of change initiatives in our city. And these items are beyond just the delivery of core services in each department, those services that we deliver each day. These items actually are really big challenges that require cross-departmental coordination and focus, as well as working with other governmental agencies in our area, and of course, our nonprofit partners to really make a difference. So we see this roadmap as our tool to help us clarify our priorities, design a transparent arena for input and deliberation. It's a way to align with our budget process as a strategic planning mechanism. And then it integrates an equity-based approach to the city's decision-making. And so the approach has been the creation of 8 enterprise priorities. And I'm not sure if you can see it on the slide, but on the left-hand column in gray, these 8 enterprise priorities are shown. And then each enterprise priorities has a series of different initiatives, and those are located in the light purple boxes on the slide. So there are a total of 41 different initiatives across the 8 enterprise priorities. And then you'll see in our first row on the slide is the COVID-19 and community and economic recovery. So that's the city's first enterprise priority. And if you'll go across that row, you'll see in each one of those purple boxes, it represents a recovery initiative that is already underway. And all the way to the right and circled in red, you'll see the COVID-19 Recovery Task Force. So this task force was created by the City Council back last year. Next slide. So our Recovery Task Force is made up of actually 55 different organizations throughout our community. So this slide and the next slide lists all of those organizations. So these are diverse groups that represent our community, and they include health organizations, education and faith-based groups, homelessness services and affordable housing, labor groups, small businesses, workforce development, arts and culture, groups working in race equity, and really just a host of community-based organizations. And so we recognize that these organizations have long partnered with the city, and we are again calling on them to help us build back better in our community and really help the city, help us all connect the resources and services to our community members who need it most. So next slide. And before I go on, so I just want to acknowledge that the Recovery Task Force had its kickoff meeting in November of last year. We had our second meeting last month, so we are well underway. We've gone through a series of just orientation, making sure the task force understands who they are, what the purpose is, and what they're being asked to deliver. And they've also received updates from our city departments on the recovery initiatives thus far. And so really the scope of the task force, really focusing on 3 key areas. We are looking to stabilize and strengthen our families throughout our communities. And this includes the physical, mental well-being of our families, looking at housing stabilization, childcare and senior care needs, education, and digital equity. And really, these are all of the elements that are required to support and lift up our households and our communities. Secondly, of course, we're focusing on supporting our workers. We know that a lot of help is needed in assisting our workers with training, in some instances, retraining and reemployment. And then, of course, we're focused on supporting our small businesses, so many that were severely impacted throughout the pandemic. Our small businesses are located in our neighborhood business districts throughout the city. And we're also focused on helping our micro businesses and sole proprietors who really had a lot of difficulty navigating some of the assistance and really the dollars that were being offered throughout the pandemic. Next slide. So in terms of the role and responsibilities of the task force, there are 4 key areas that we're looking to the task force to work with us on. First and foremost, we are looking to them to advise the city departments and staff in monitoring our progress on the recovery initiatives. And as I mentioned, Aurelia will share a little bit more about those. We really need their help in getting information out to our residents. So as these services and resources are being deployed, making sure that they are connected to those who need the most. We are looking to them to help us engage our community, and particularly reaching those voices that we don't always hear. And this is where we know that the task force members are so valuable, because they already have these trusted relationships with our members in our communities, with small business groups, and with individual businesses. So we're looking to them to help us reach our community and engage, and to really hear from them about their stories, about perhaps some gaps that may exist in service delivery, so that they can bring that back to us, to the larger task force. And then they'll have an opportunity to discuss and decide if there are potential new items that should be brought forward to our city council for their future consideration. Again, we want to leverage other efforts that are underway. We've talked with several of our partners about, stacking the various resources that are available to our community to make sure that there aren't redundancies and that we're not stepping on each other's toes, to make sure that we're getting the biggest bang for the buck in terms of getting the dollars out to our community. Also, just want to mention that the task force has already indicated that they're interested in setting up either solution groups or committees around particular topics and or interest areas For example, around hospitality workers, that has been a common theme that has come up. And so at our next meeting, actually it's just next week, we'll be working with the task force in terms of their ideas for other committees, solution groups, and getting that work underway. Next slide. So with that, I am now going to turn it over to Aurelia, who will talk about the 6 individual recovery initiatives. Aurelia.
Thank you, Rosalind. Good morning, everyone. As Rosalind has mentioned in her previous slides, the first row, which is the first enterprise priority, is all about the COVID-19 community and economic recovery. As you could see, I know somebody, I believe in the chat, had said it's really hard to read. So what I'm going to be covering in the next few slides, is the Recovery Task Force and where her work has been on, and then also the other 6 project items that are recovery initiatives that are already ongoing by various city departments. Next slide. Thank you, Anna. The first initiative is housing stabilization. This work is done through our housing department. The work is centered on racial equity and community, targeted in reaching extremely low-income households, reaching households of color, households that are most vulnerable of displacement or homelessness if they lose their housing, and households that are in areas that have been disproportionately impacted by COVID-19. There are 3 focus areas. The first one is on community engagement. This is really to inform low-income residents and their landlords on how and where to access rental assistance and how to access eviction protection. The second focus is the emergency rental assistance. Gerald mentioned a little bit already about this, but the housing department has actually also partnered with local partners and the state to deploy direct financial assistance. Their goal is to deploy a total of $66 million in emergency rental assistance to over 5,000 households by 2022. They actually have a few unique things that's happening in the housing department. One is they've been doing offering in-person help for households to complete rental assistance application. And then the other component is that they've actually opened up 2 eviction, what we call our eviction, eviction rental assistance. And one is located at City Hall, and the other one is at Franklin McKinley School District. And then recently, staff has been to court 2 days a week on the days courts are hearing unlawful detainer cases. And then the county has expanded services to the vaccine clinic on Story Road, and they've now created services hub that offers in-person assistance as well as quarantine support. The third focus is on legal assistance and tenants' rights services. The housing department is working with local nonprofits to provide additional support. They have partnered with Law Foundation and Bay Area Legal, providing on-site legal support and referral consultation at our Eviction Prevention Health Center. Next slide. The second initiative is reemployment workforce development. And this work is done through our Office of Economic Development and Cultural Affairs under the Work to Future program. The work is focused on low resource census tracts to reach marginalized individuals. Even with our economy having a 3.9 unemployment rate, the reality is that there's still a significant portion of our population that continues to struggle. Work to Future continues to address on high growth, high wage occupation for marginalized individuals in our area. And they have partnered with industries that are favorable, such as construction and trades, advanced manufacturing, information technology, and healthcare. The team is currently working on relocating the one-stop shop to Eastside San Jose. continuing to outreach specifically to low census tracts, and then also working on entrepreneurship pathway to assist undocumented low-wage workers. Another program that Work to Future recently implemented is Resilience Core. This is a work experience program to address two of our most urgent crises, climate change and the pandemic. Over 7 million American Rescue Plan funding have been funded for this program, and they currently have 195 enrolled in this program. Next slide. Also, another initiative that our Office of Economic Development and Cultural Affairs is leading is small business recovery and business development. The first one is assisting the most vulnerable, building small business ecosystem, direct financial assistance, stronger commercial corridors, and monitoring the city's economic health. In the next 2 years, this is what the team is going to be focusing on. A great example is the first one that I mentioned, assisting the most vulnerable. They are currently working with a group of people on creating a small business displacement policy, and then also opening up at Quetzal Garden a small business center with the help of our community partners, Latino Business Foundation and Somos Mayfair. And then they're doing a variety of outreach. And then also on top of that, the third one is the direct financial assistance. Up to 2 million will target small business owners who have not actually received either state or federal government grants. The other component of the small recovery is that our arts were among the first within the community to close during COVID-19. And they were the last ones to come back because of restrictions of gathering. So as a result, Office of Cultural Affairs actually has been leading this work, where a total of 2.2 million ARP funds provided to grants to art nonprofits and creative entrepreneurs. And so they were able to fund 109 grants were awarded by OCA for arts and cultural program. Next slide. Another initiative is our food and necessities distribution. This program is currently being managed by our Parks and Recreation Neighborhood Services. Our program continues to facilitate over 9 million meals per month to residents most vulnerable and affected by COVID-19. Not only does they provide meals, but are also grocery delivery services for seniors, homeless, low income, and our vulnerable residents in federally defined qualified census tracts. In the slides, these are just some of our partners within San Jose and in the county. You know, our partners have been such a huge asset during this time, and it's our goal to continue to provide food distribution and invest in food insecurity in our community, as where there's still a huge amount of need. Just a couple of highlights from the team. City has helped facilitate the distribution over 200 meals within the county since March of 2020. The American Rescue Plan funding of 14.8 million, which is allocated for food and necessity for this fiscal year, and then also a total of 10.1 million. American Rescue Plan is also allocated for food boxing resilience core. Next slide. Our digital equity initiative, this is led by our library department. One of the greatest impacts of the pandemic in our community was that it worsened the existing digital divide and deep inequities in digital access connectivity. With the library staff leading efforts, several of our other city departments were also part of this effort. The Department of Parks and Recreation, Public Works, the city manager's office, and then also the Information Technology Department, centering their work around equity and focus on alleviating the digital gap for students in distance learning, and then expand opportunities for Wi-Fi around city facilities. Again, so just some of the highlights for this team in the last year, over 12,800 hotspots were distributed to students across 32 local education agencies, circulated over 3,000 hotspots through San Jose Public Library, and just a couple of things that the team is going to continue to work on this coming year is to continue to support the local education agencies, continue to manage the Wi-Fi built out throughout San Jose, and then work expanding awareness on just the emergency broadband benefit program. And then lastly, providing additional leadership to San Jose Digital Inclusion Fund as we develop the round 3 grant proposal. And then the last initiative for us under the COVID-19 Recovery Initiative is that Childcare and Youth Services. This program is also another partnership with Parks and Recreation Neighborhood Services, along with the Library Department, to provide childcare and youth services. There's been $4.8 million awarded in scholarship during the fiscal year of 2021, and then this coming 2022, distributing nearly $5 million in scholarships to our residents, therefore providing much needed support to those families need of affordable childcare. Over 300 staff supporting childcare program. Over 100,000 meals have been distributed to the child care program. And then currently there are 56 programs that are currently operating to provide child care between the ages of 3 and 18, from preschool classes, after school program, and the library offering virtual homework clubs. And then lastly, we like Daryl and Rosalind already have mentioned, we could not have done this work without a lot of our nonprofit agencies. Many of them, or many of you, are, our partners are deeply rooted in the community and whom our residents trust. And so the city, again, could not have implemented a lot of this work without your partnership. So thank you. And like Rosalind mentioned, our next recovery task force will take place next Thursday from 6 to 8 through Zoom. Please feel free to email us and we could send out the link to you. So thank you.
Okay, thank you, Aurelia, and thank you, Rosalind. If any of you on today's session have questions for either of our 3 presenters that have spoken so far, feel free to either raise your hand or use the chat or direct message me, and we can figure out how to get your questions answered. And also, if there are other representatives from the other jurisdictions in Santa Clara County that have additional information to share, please raise your hand or direct message me. I see Laura Mecklin from Uplift has her hand up. Laura, did you have a question?
Hi, good morning and Happy New Year, Anna. I have a question for Daryl and the county COVID response and the requirements for nonprofits. At Uplift, we're in the process now of gathering all the information from all of our staff regarding their booster status. And I know Santa Clara County has a history of being a little bit more conservative with their dates than the state does. For example, I believe the Santa Clara County is requiring booster verification for staff by the 24th of January, and the state has a drop dead date of February 1st. So that's one example. But what I'm really concerned about, and I have a question for you about, Daryl, is that in a recent message that I received from Santa Clara County, it stated that in higher risk settings for staff, staff are not eligible for testing, and 100% of folks must have their booster shot. So at this point, we have a very small number of direct service staff who are exempt and are testing weekly, which will go to twice weekly testing. And my question for you is your definition, the county's definition of higher risk settings. Right now, we're looking at our crisis stabilization unit because it's a 24-hour locked unit for kids on 5150s. But I was wondering if your definition or the county's definition of higher risk settings, it also expands to direct services for outpatient services or community-based services or our staff that are going into school-based services. So because if it does, that may have a significant impact on service delivery and our productivity and meeting our contractual agreements and all that. So yeah, at this point, we're really scrambling because we're pretty much we've pushed up until Omicron. We're back to almost complete in-person services. And now we're pulling back because of the numbers of Omicron being diagnosed to having more telehealth services. So we're doing this balancing act right now for our staff and messages to send out. So I guess long-winded question, but the main question I have is what qualifies in Santa Clara County for the higher, quote unquote, higher risk settings? And are you in alignment with the OSHA definitions for high risk, higher acuity settings?
Laurel, I don't mind telling you that I'm going to check with our public health folks. The definitions are like legal, they're like lawyers and stuff like that over there. So I want to make sure that you get the most precise and accurate definition as possible. And I don't want to give you any, I don't want to mislead or misinform you at all. So I've got your name here with your question about specifically what defines direct services. Yeah,
just mind... basically, yeah, if you're in alignment with the OSHA definitions for, or if there's variation in Santa Clara County that we should be addressing as we, provide, as we plan for the next several weeks of COVID response for our staff.
Yeah, let's get you connected directly with Daryl and with public health and see if we can get your question answered as soon as possible. Thank you, Laurel.
Okay, thanks, Daryl and Anna.
Okay.
Thank you.
All right. Well, let's keep moving forward. I don't see anything else in the chat and I don't see any other hands up. So let's keep moving forward. Our next segment is really kind of focused on, well, so what does this all mean to you as community-based and faith-based organizations throughout our county? We have invited two speakers to talk a little bit more about nonprofit perspectives on recovery planning. And that our first speaker will be Nick Kawada. Nick is the policy director for our Silicon Valley Council of Nonprofits. SVCN has been essentially like a sister agency to CADRE through most of our COVID response and recovery activations for almost 2 years now. Since 2006, Nick has served as an advocate for low-income and immigrant communities. He started his nonprofit career as a volunteer and then a staff attorney with the Asian Law Alliance. And prior to working for SVCN, he was the program manager for the county's Office of the Census. So Nick is going to kick us off, and then following up from Nick, so I don't interrupt the next segment as well, is Quincy Phillips. Will also be joining this. Quincy is the executive director for Joint Ventures Building Back Better initiative that was established just last year in 2021 as the backbone effort to support regional recovery and reduce stark inequities magnified by the pandemic. And so Quincy's background comes from a strategy officer at House Keys in Morgan Hill. He has a diverse background in the both nonprofit and private sector. And I'll go ahead and turn the program over now to Nick to get some nonprofit perspectives.
Thank you. And good morning, everybody, and Happy New Year. It's great to see so many energized faces on this call today. And I do want to definitely highlight the fact that Q, not only is he a better speaker than I am, but you're definitely going to stick around to hear about what Building Back Better is doing. So please stick around for that. But anyway, as presented, my name is Nick Kawada. I am the policy director for SVCN. And, props to CADRE for putting on such a fantastic event, really level setting for all of us, exactly what to expect with regards to recovery. And, recovery is very multifaceted, is what we have learned. Recovery, in the disaster context and in the nonprofit context, we've been calling response, has been obviously an ongoing presence in the conversation because, unfortunately, when ARPA was first kind of passed, we had a different view of the world. We didn't expect variants to continue to, plague us moving forward. So obviously the understanding of recovery has changed. And whatever I say in this conversation, we do want to underline the fact that, it is because of the efforts of people like Daryl, Rosalind, and Aurelia thank you so much for your partnership and coordination on some of these things to make sure that first part is there, to make sure that response is happening, to make sure that recovery is first and foremost in our minds. Also wanted to give the city a large thank you for their work and commitment around the Recovery Task Force, SVCN, as a co-facilitator of the Race Equity Action Leadership Coalition. Really values that partnership and appreciates the fact that you were there to respond to some of the partnerships that we had suggested, as well as the format and makeup. So we really appreciate all your work. Thank you so much, Rosalind, you especially. We can move on to the next slide. So I want to quickly kind of go over what ARPA is and was, and then talk about what CBOs in our real coalition have been up to around recovery. We move to the next slide. So the American Rescue Plan it was a $1.9 trillion bill that was passed, really to stimulate the economy, really help put money back in the pockets of individuals, but also to help stimulate a number of different facets of our community that really were destroyed by the pandemic, really set back quite a few generations. So this was a great opportunity for community-based organizations to echo the concerns of their community, as well as make sure that we were there on the front lines for communities to make sure that they became whole again as well. Especially because the pandemic, as Daryl had mentioned, had really affected us all so differently. It really did depend on what your racial makeup was. It did depend where you lived. It depended on your ability to pay medical bills, et cetera, right? So there are so many different things to this that we really feel have an equity lens to it. And you'll see me kind of discuss that as we move forward. Next slide, please. So the ARPA allocations were as follows: about $27 billion to the state. The city of San Jose, one of the cities that did receive ARPA funding. Most cities did in the county, about $212 million. And thank you, Daryl, for the correction. I believe it was closer to $400 million for the Santa Clara County's kind of take. So just to kind of put level set where we're all kind of at. Next slide, please. Now, the American Rescue Plan, as Daryl mentioned, was easier to spend than some of the other acts. However, there are still some objectives to it. It really was a urgent COVID response funding effort. This was to decrease the spread of the virus, of course, in that whole response discussion I had earlier on. Also to replace lost public sector revenue and strengthen and support those vital public services and help retain jobs. Create that economic stabilization force and also address some of the systematic public health and economic challenges that we were seeing due to the pandemic. Next slide, please. As such, there were certain rules around ARPA, and technically, I still think they're under their first rule. I think they're still looking for their final rule. It's still being kind of decided at the moment. I'm sorry, interim rule. And some of the qualified uses were really against this immediate effort effect. So you couldn't see jurisdictions just haul this money away, put it under lock and key. They did have to spend it for particular uses, things like loans, grants, and tech assistance to businesses, pay for essential workers, which we saw here in the county, infrastructure costs. And one of the most important ones that the Race Equity Action Leadership Real Coalition really focused on was the equity focused services. So that's where we kind of that's what really caught our eye and what we kind of focused on. Next slide, please. So focusing on Santa Clara County, the real coalition, as mentioned before, next slide, please, is really this coalition of many nonprofit leaders and allies. And this really came together after the murder of George Floyd. in response to a lot of the racial inequities that we were seeing that have been generalized for so many years here in the county and of course nationally. And we really felt it was important for us to take action. And that nonprofit racial equity pledge, which we had so many of our partners sign, really making them look not only at the world and the people they were serving, but their own organizations as well, what they could do to level the playing field, address some of those racial concerns that maybe they had not been spoken about before. So this was kind of, again, our great opportunity to look at a new way of doing things. And we feel that ARPA was one of those opportunities. Next slide, please. So we began this conversation early with both the county and city around what we called the principles for recovery. And this contained several different notions that we felt were needed to be addressed in any sort of budgetary decisions around recovery. And, really, again, highlighting the transformative change aspects as well as fourth racial justice and liberation. We wanted the process to be open. We wanted a community process. We wanted a coordinated process. As you can tell, a lot of folks are doing things that they've never done before or doing things that other folks usually do. So that coordinated effort piece was so important for us, as well as maintaining the level of transparency that we could all rely on so that we knew who to talk to, where to go. Because again, this was a great opportunity for us and we didn't want to spend it needlessly. Next slide, please. So we followed up that principles document along with several letters and through the budget process, as well as public comment at a number of meetings that all the way until the end of last year. We actually have these proposals available for folks to see. So I think when we send out this slide deck, please use that link to kind of see it. But it is a great opopportunity for folks to see exactly where we're coming from, see the proposals as they are. And that's what I'm going to kind of go through next, is what those proposals are. So next slide, please. So our 20-page proposal document really covered several different things. They were in areas that we felt were,
Nick,
yes.
We're having a little trouble with your audio right now. I don't know if something changed for you. It was clear.
I have been getting some in messages. I apologize if that's the audio. Am I sounding okay right now, or?
It's like really fuzzy.
Okay, 1 second. Let me try this.
Hang on with us, folks.
How about now? Is it any better?
Oh,
No.
no. You know what we might try, Nick? If folks can bear with us for just a moment, what we might want to do is have you call in with an audio phone connection to continue.
Do we want to go to Q while we're kind of doing this? Kind of jump back to me?
Is that a natural?
Sorry about that, everybody.
Yeah. Let me push us forward and then we'll come back to, because Nick only had 2 slides left. So let's push us forward to Q and then we'll come back to Nick's final 2 slides. Thanks for your flexibility and go ahead, Q.
Oh, thank you all. Appreciate it, Nick, for allowing me to come into the game early and not finish it off, especially with the pressure that you put on me. I'm actually, you all can tell, I'm about cheat codes as well. I'm the executive director. Hi, Quincy, you can call me Q, for Building Back Better, which is actually attached to joint venture Silicon Valley as our fiscal sponsor. But really right now, I'm here to talk about Bridge to Recovery. So thank you all, who have already spoken before me. I feel like that's our job right now, is like council members, stewards, all of those other folks. Really appreciate the work that you all are doing. I'm also sitting at the tables with all of you. So again, my goal is to be brief and really talk about programmatic things in the ways that a lot of the nonprofits, especially within our initiative, are moving things forward. So next slide, please. Here we are, path, position, in place. So I also have to do this, tell us, where we started and also where we're going. There's a bit of deja vu, happening right now, especially, with the purpose of this. You don't know me, my birthday is March 10th. And so I had the last party that shut down the whole economy in the United States. And then we turned into this pandemic. And from that, the county actually created, the entire county, not speaking just Santa Clara County as an institution, but all of those, the community, the residents, the stakeholders of the county came together in response to that pandemic. And what we ended up seeing was over 150 stakeholders, coming together to have monthly meetings in a connecting and convening capacity, but really as volunteers. They were already doing so much of the work and the heavy lifting, in terms of the response. We were learning things on the fly. So much was coming at us. Everyone that's a part of this that's spoken, everybody that's viewing this, you are a part of this as well. But I also want to provide this as a moment of clarity too. Daryl gave a huge shout out to start this, and he put that $14.1 million part. That, for clarity, it didn't come to Bridge to Recovery, but as part of our network, a lot of the organizations that are within the network actually receive funding directly from those dollars. But just wanted to clarify that we, as Bridge to Recovery, didn't receive those dollars and then pass them forward. Because as we started, this was an initiative that was held at Catholic Charities. And so as we moved into 2021 and the work that was done within the working groups that came together, half safety net, half workforce, really thinking about the road to recovery, jobs, access, the opportunities that were still needed by those of us that were the most vulnerable, right? And so in 2021, the transition started to happen. We needed to be more than just a volunteer-based network, right? And as we talk about volunteers, let me provide a little bit of clarity to that term. Volunteers are normally the folks that are just people, or at least volunteers in the way that this came together, were really thought of as just the good. This is just something that I should be doing. If I have the capacity to do more, I will do more. As we evolve and as we think about that volunteer-based term in our network, we really were no longer volunteers. We were really institutions, organizations that were willing to take parts of their time, capacities, dollars, and cents being spent to lean into this initiative. So at this point, in terms of me coming into this and joint venture being the new fiscal sponsor, I was hired and I started in August. And a big part of what my goal was to transition us from a volunteer-based network into a strategic organization, which then meant that we needed to have a lot of resources. We needed to have a lot more than just a hope, a prayer, even the reality that we do have to do more and that we do have to do better. We need to supplement that. And so as we go into 2022, this phase is really around programs, operations, and metrics. You're looking at the executive director. My goal is to start to hire people in strategic positions that really will help us obtain and do the how, like obtain the funding, obtain the resources, and really navigate within our working groups, in our entire network, how we can, on our own, fail forward. A lot of times we're looking for grants that are very targeted and specific. What we're seeing now is we might be going into another shutdown. Those that are closest to the work, those that are the most affected, those of us that have family members that are in the trenches, and this is our livelihood, we're going to continue to be affected. So let us take that community-centered thinking and opportunity, and we receive those funds, resources, and allow us to fail forward. We've been doing a lot. People have talked about Somos Mayfair and the opportunities that are even happening with that Latino business. That also takes more capacity, right? There are organizations within our community. Those organizations have done the work and they now should be trusted to do even more. So that's one of the things that we want to do within this Bridge to Recovery network as we move forward. Think about strategic initiatives that allow us to really fail forward. We know the work, we've been thinking about it. We need to align our resources. We need to think about being disruptors. So that's when we talk about systems change and those things. We're trying to eliminate the status quo. We're not trying to do the same thing. We're also looking for economic mobility for all. And so with that, as where we're starting to go, one of the things that we now have to center ourselves on is that Jedi mentality: justice, equity, diversity, inclusion. Like, we really have to lean in that. And there's a lot of the operations that are going on right now for me in my little lab to really think through how do we operationalize with something that's solid, that all of our network needs, and also something that provides accountability as we move forward. And with that, I'm gonna take to the next to last slide for me. When we came, and as we continue to move, we're united. We want to create these paths. We want our own version of economic freedom. And for us, a lot of that is family sustaining income for all. And that can be a single family, that can be an individual, a child that's trying to grow. We don't know what that family dynamic might look like. And so as we think about it, anyone that wants to have their own individual family system and environment, we want that type of economic freedom. And so as we look forward into this first phase of the new Bridge to Recovery turning the corner, one of our biggest things is countywide resource alignment. We're all on here together. Thank you, Anna, for pulling this together, because normally we're all in our pockets just trying to figure things out. We're doing the best that we can. We know we have to do more, and so we do. Now we have this opportunity, especially as you all saw a little bit, there was a lighthouse that was a part of it, to actually illuminate and see the places that we can reduce the redundancies and create the true intersectionality that we actually need to move things forward. So not to take money away from anyone or anything like that, really to provide more resources so that we can identify the true type of support that we need. And then we're looking at the safety net, we're also looking at workforce development. As we look at systems change, again, this is the fail forward, eliminating the status quo, and also really censoring, having to educate all of us, myself included, especially when we think about JEDI. What does that mean for us? Us uniquely, Santa Clara County, Silicon Valley, not just something that we might talk about at a high level, really being targeted and unique to identify what our JEDI mentality is actually going to be. So there'll be some education as part of that. We're going through it. I'll have a meeting in a couple of weeks during JEDI week. Invite some of you all, especially if you hit me somewhere. But the other part of that is the action and then accountability, kind of putting those two words together. I was torn because there's a bit of us that have to put the metrics and data behind it to support the action that needs to happen, but also there's been so many who have been involved in speaking and pledging around this work. Here's our opportunity to apply accountability to that whole equation. And finally, economic mobility, really also being targeted. Our strategic initiatives, when we start to talk about social entrepreneurship, we're really thinking about targeted communities, our youth, communities of colors. We're thinking the East Side, all of the things that we are uniquely responsible for, enhancing, and also sustaining. And so those are some of the opportunities that we're looking at. Worker co-ops, we know what we need. We're about to go into another shutdown again. There are home cooks. There are so many people within our neighborhoods that with a worker co-op and that type of thinking, really thinking about other ways for us to find our economic freedom, not just playing within the world that we're supposed to or being told, really finding and identifying those opportunities again to fail forward. And finally, job creation. The summer is on us. We're about to go down into another, again, shutdown. We really need to be better prepared, and we know and have lessons learned from the past 2 years. And so we'll start to be intentional about looking into that. Next slide, last slide, and I'm off my soapbox. I'm a preacher's kid if you didn't know that. Lighthouse effect. Seen, heard, and included. So all of you who might be interested in learning more and maybe being a part of Bridge to Recovery, we're in that phase. We want to open the doors, welcoming all in. The more information, the more data, the more insight that we have, especially at a lived experience and community experience, and anybody that's been disadvantaged or the inequities that we were talking about, especially Nick, with the Real Coalition and those things. We really want to be targeted. And that's what we're talking about with this statement of purpose. We unite to place every individual and family on the path to economic freedom. And we're really hoping that you all will come and join us. That's it. Thank you.
Wow, Q. Thank you for that really energetic and uplifting presentation. Nick, that's a tough act to follow. Let's see if your audio is back.
Is it working now? Any better now?
It's wonderful. Keep going. I'll get you back to your last 2 slides.
Like I told everybody, Q is a fantastic speaker, way better than me. I wish we could have ended on that energy. I always feel more energized after I hear him speak. So thank you for that. Just really quickly wanted to go over what the letter contained, and I don't want to take folks' time. You guys can read. But some of the priorities that the Real Coalition had kind of forwarded was around racial equity, specifically around looking through our budget and programs, both of them with the racial justice and equity lens. Some wealth building program strategies as well, some of which actually traction up at the county with BI. It was actually one for housing. So if you're interested, that's actually going to be upcoming soon. There was one around Black Investment Initiative that I highly encourage folks to take a look at. We had really great thoughts around that, really great models to kind of build from. Next slide, please. And then the Nonprofit Sustainability and Capacity Fund over at the county actually saw light of day. There's going to be $5 million allocated for this year and $5 million for next year. We're trying to put that together along with a CEO, so there should be information on that forthcoming. Then around health equity, discussions around a behavioral health workforce pipeline pilot. We know that behavioral health specifically has had staffing shortages and staffing challenges. So, how can we motivate our community to help fuel those employees, fuel that workforce to get into that area so we can, spend that money effectively. Healthy Food Resiliency Infrastructure Fund was another one, in terms of creating a program that, saw all aspects of what the city of San Jose has been doing and what the county has been up to. And then around democracy and community engagement, a community partnership and civic engagement initiative from both CBO side as well as from the local government side. From a tourist model, we saw great success with this during the pandemic. We want to see that continue and expand it. And then in terms of alternative policing, we had two ideas around a 911 community awareness program and response campaign that had educational activities for the community and when to really understand to deploy 911 and understand the other alternatives available to them in cases of emergency, especially when mental health is involved. And then, of course, reducing jail populations by creating a fund for nonprofits to help people transition back from pretrial custody to community life. So that was The Last of Us. Sorry you had to end on the boring one, but you got to hear Q, so I figured that's kind of a blessing in itself. Thank you.
Yeah, thank you, Nick. And so let me just open up. We have just a few moments left. If any of you have any questions, any comments, any additional bits of information you'd like to share. Glenn Williams, I see your hand up. I'm going to unmute or allow you to speak in just a moment. While we go to participant questions and comments, I'm going to launch our participant evaluation poll. If you will oblige me, this is what helps keep us going with our funding to offer these types of programs. So Glenn, go ahead.
Good morning. I wanted to let everyone know of an additional program that will be coming up. The state of California has created something called a micro business grant program. The county of Santa Clara applied for and has now received approval to be the fiscal agent for about a $2.4 million program for the smallest of your small businesses. It really is targeted to sidewalk vendors, to individuals, self-employed individuals, those who are at risk of their entire livelihood having been taken away by the program. The grants are $2,500 each. We will be accepting the grant officially at the board meeting next Tuesday, and then hopefully have the infrastructure in place to begin advertising the program before the end of the month. The key to this is you have to have made less than $50,000 a year in 2019. You have to still be or about to reopen an operating business in Santa Clara County. The program will be administered through the Enterprise Foundation and the Hispanic SBDC and with Dennis King. And if anybody has any questions about the program or is interested, I'm certainly available. In addition to the Hispanic SBDC, we're partnering with at least 12 additional community-based organizations to help get the word out and make referrals for the program. We'll be able to offer at least 875 of these grants over the next 10 months. Thank you.
Okay, thank you, Glenn. And for those of you who didn't know, Glenn is with our County of Santa Clara and is titled the Asset Development Manager. So thank you for sharing that. I am noticing, even though I'm having a technology problem, even though I did launch the poll, it didn't apparently want to go. So, you might get a little survey from me at the end, okay? And if you wouldn't mind putting just a few comments in the chat box for my funder to let me know how you enjoyed today's program, if you feel like we met our objectives today, if you find the information that you've received through today's program valuable, inspiring, whatever. Give me a call. Oh, the poll launched. Okay. I'm not really sure. I'm not getting results. So thank you, Dana. If you could put a few comments in the chat box, then hopefully Ivan will bear with me on my technology challenges for today. So with that, I think a gracious thank you to all of our presenters today, to Daryl, Rosalind, Aurelia, Nick, and Quincy. Thank you for sharing your expertise with all of us today. Thank you for your invitation to become more involved and to really foster whole community planning for Santa Clara County. We invite you to stay connected with us, to view the presentation, direct message me or any of us at the CADRE email box. It's admin@cadresv.org if you ever want to reach us. And that same www.cadresv.org is our website where we will post today's program and follow-up information, additional handouts and resources. And with that, it's 10:28. I will give you back 2 minutes of your life this morning. And thank you all.